Good morning, ladies and gentlemen. This is Jim Roddey, and welcome to the best of Allegheny County. The focus of our show is to introduce you to successful people who have a personal connection to Allegheny County, and the show is presented, of course, by St. Barnabas, which has been caring for people in southwestern Pennsylvania since 1900. Today in Allegheny, Beaver, and Butler counties, we offer the full continuum of care, including independent living, living assistance, skilled care. We have a medical center, memory care, home care, and dental care, and much more. We have a special show for you today with everything that's been going on with the coronavirus. We're hearing a lot of news about how you might get treatment or information through something called telehealth. While the telehealth technology and service has been available for many years, most of us haven't had a reason to use it. And you can learn a lot of things and get a lot of good information through telehealth. If we were sick and needed to see a doctor, we made an appointment and drove to the doctor's office. Today, of course, we stay at home and have all these restrictions. And it's not as simple as it was in the past, so we thought it would help to have someone that's an expert that can explain what telehealth is and how it works. With us today is Annmarie Sandor. She's a nurse practitioner at St. Barnabas. I know Annmarie well, and in fact, I have been to her for some treatment, and she is just like going to the doctor. She knows as much as the doctor, but she just doesn't have doctor in front of her name. Welcome, Annmarie.
Thank you. Good afternoon, Mr. Roddy.
Well, it's nice to have you on the show, and tell us just a little about yourself quickly, about how you came to be at St. Barnabas.
Sure. I'm a nurse practitioner at St. Barnabas, and I'm one of 4 amazing medical providers at the medical center at St. Barnabas. I am a mobile practitioner as well, so I can go to office, the assisted living facilities, and nursing home, and I also have been performing telehealth visits.
The telehealth is really exciting. Have you had experience with it before?
I have had experience with it before. I worked with Dr. Handler over at Canterbury Place when this was all being started a few years ago. It's exciting, and it's come a long way since then. We have a long way to go, but it's really come a long way.
Well, it has. And tell us quickly, what is telehealth?
So telemedicine or telehealth allows healthcare providers such as nurses, doctors, physician assistants, and nurse practitioners to conduct medical visits wherever you are. So whether you be at your home or on vacation or having a break at work, we can be available for you. We have flexibility in scheduling, and we take the time out of your day that it would require you to come to the office.
Well, now, what kind of equipment do you use?
We just need a smartphone or a computer. That's pretty much all that we need at this point.
Now, the person that is receiving the telehealth information at their home can use their own home computer.
Home computer or a smartphone. We can't
or a
use
smartphone, either one. Now,
right.
Can you see the person?
There are audio and video capabilities through
the
program that we use.
Right. Well, that's come a long way since it first started.
It sure has.
Would you walk our listeners through a typical telehealth visit?
Sure.
Let's say you schedule to talk to me at 2 o'clock today, and how would that happen?
Well, first we ask you to download the application so that we can communicate on the same forum. And the application that we're using in the office right now is called Doxy, DOXY.me, M-E. And the medical staff over in the office, who can be reached at 724-443-7231. They place you in a queue, and they give me a text, and both the patient and myself can meet on the computer through that application at that specific time.
So that gives you some baseline information.
Right. Also forwarded to me are the patient's past medical history and medications and pharmacy so that I can prescribe any medications if need be.
Well, now, what sort of information would the patient that you're talking to have on hand for this call?
Well, I would need some sort of photo ID so I can make sure I'm talking to the right person.
All right.
I will also need their medical card, and they need to consent to being seen in this forum. So we do need their verbal consent to be seen via telemedicine.
Right. Are you taping this? Is there a record of it when you finish?
I don't believe that there is. We are documenting the visit as we would a face-to-face visit in the office.
Okay.
And
Now,
I don't believe that it is being recorded.
Are there some general guidelines that you could give our listeners if they were trying to decide if they would use telehealth or be seen in the office? That's always an option, but if they can't get to the office, don't have a way to do that, would like to stay in their home, how would you advise them?
I would advise them if it is one or two problems or concerns that we can handle via telemedicine, that would be optimal. If you have more concerns or if there is a need to obtain vital signs right at the office, such as blood pressure, listening to heart and lungs, those are capabilities that are kind of outside the scope at this point right now. I'm sure in the future we're going to be able to do that electronically as well, but currently we don't have the capabilities for that. And absolutely anybody who has any concerns of a communicable disease, we would prefer to do the telehealth visit.
Now, are telehealth services covered by insurance?
Since the coronavirus outbreak, the Centers for Medicare Services are covering all of these visits. We're expecting that most of the other commercial insurances will follow suit.
Well, that would be good news for just about everybody.
If you have any concerns about insurance, feel free to call the office and they'll walk you through that and they'll let you know exactly what your responsibility might be. Even if you don't have insurance, we're still happy to do these telehealth visits. We'll work with you.
All right. Now, what should our listeners do if they would like to schedule a video appointment?
We would ask that you call the St. Barnabas Medical Center so we can check your insurance and get a time slot for you to be placed into the queue. And the phone number is 724-443-7231, whether it be existing or new patients.
Now, can you tell me about how many times it's been used since you've started this? And you really started this fairly recently, didn't you?
We did, and I expected there to be more, problems with it. Amazingly, there has not been. The connectivity has been well. It's easy to use. Even, in the older population, they seem to be picking right up on this. It's not a problem at all.
Well, so many people that are my age, elderly folks like old geezers like myself, we are afraid of technology. And what can you tell our senior citizens that will ease their mind that this is an easy thing to do?
It is. The application has made it so easy. You just make the phone call to the office. We take care of all the scheduling, and all the patient has to do is click on the Get Started link at their appointment time. There's just one thing they have to click. That's it. They download the program, and then one click. We've really made it very easy.
Well, now, when they're talking to a nurse practitioner, tell me what training do you go through that is beyond just a nursing degree? What extra training do you have to reach the level of nurse practitioner?
Well, you have to have a 4-year bachelor's degree. And at the time when I went back to school, you also had to have 5 years of practical experience before they would let you go back to school. They've laxed that up a little bit, and now you only need 1 year of nursing experience. So I graduated with my bachelor's degree in 1993, and in 99 I got my practitioner. And that was one of the first ones in Pittsburgh. It's been a great career. It's changed a lot for the better.
Wow. Now, can you prescribe medicine?
I can prescribe medications. I can order imaging tests, blood work, anything that you would get from your primary care physician.
When do you make a decision that this person should see a doctor?
We kind of all communicate together. We work as a team, so even if you're not seeing a doctor per se, we run everybody's cases by the doctor as need be. If we run into the problems, we have a nice collaborative agreement with them. Any of the more difficult cases, we do sit down and discuss.
So you show everything to the doctor. The doctor reviews everything about the telehealth conference that you've had. And if he or she feels that the patient should come in, then he'll let you know and you can convey that to the patient.
Right. Or if the patient doesn't get better on the initial prescribed treatment, we would recommend they come in.
Well, that sounds like makes healthcare very easy and easy to navigate. And so, about how many of these do you do? Do you do it sporadically through the day, or do you have certain hours that you concentrate just on the telehealth?
Well, for right now, we're limiting it to Monday through Friday, 8 to 4:30, during general office hours.
So you treat it just as if someone was sitting in the waiting room, and instead of asking them to come to the little room, then you get them on the phone and they sit by their
we meet online.
Television.
Correct.
And you're on the line.
Right.
Well, have you been pleased with the results that you're getting with telehealth?
With a few, I have been. The only limitations that I can see, I can't look in ears. I can't listen to heart or lung sounds. But I can see rashes. I can see pink eye. Any of the general medical concerns that people have.
But soon,
and I'm sure down the line we're going to have the rest of this.
But soon you'll be able to do blood pressure. And what about temperature?
I can't get that either. We have to rely on self-reporting the temperature for now.
Well, Annmarie, I want to thank you so much for being with us today. Your information has been great. It's nice to have a nurse practitioner, and you said there were 4 of you that are at St. Barnabas?
We have 2 physicians and 2 nurse practitioners.
Well, that's great. Well, thank you so much for being with us, and we'll check in again with you sometime soon to see how the telehealth is going, and we hope that our listeners will take advantage of this. Ladies and gentlemen, you've been listening to the best of Allegheny County and to Annmarie Sandor, a nurse practitioner at St. Barnabas. We'll take a quick break and we'll be right back with the best of Allegheny County.
Are you still working on that retirement checklist?
I want to find the perfect place for us to live.
I want to golf.
I'm looking for lots of activities and lots of friendly people.
We need to find a place where security is a priority.
Top-notch medical services are important.
And we have to find a place that'll let us keep lucky.
Absolutely. Well, guess what? St. Barnabas has everything we're looking for, including free unlimited golf.
Let's arrange a tour.
Ladies and gentlemen, we are back with the best of Allegheny County. This is Jim Roddey for St. Barnabas, and we're going to pivot now. Earlier, we talked to Annmarie Sandor, and she's a nurse practitioner at St. Barnabas, and we talked about telehealth. And certainly that was an appropriate thing to do with all of the scare about the virus. But now we're going to pivot and talk about Easter. And who better to talk about Easter than the biggest Easter bunny of all, a candy company, and whose president is Bill Sarris. And Bill Sarris, of course, everybody knows Sarris Candies, and he is joining us today. Good morning, Bill, and how are you?
I'm fine. How are you?
I'm great, and thank you so much for joining us. I know this is a very busy time of year for you, but just some questions about early in your career. How long has Sarris Candies been making all of those wonderful candies?
Well, Jim, my dad started in 1960 in the basement of our home. So it's our 60-year anniversary for us.
Well, every time I talk to a candy maker, they always seem to have been in business for 40 years or 50 years, or some of them 100 years and 70 years. What is it about making candies that it gets in your blood? And I'm amazed that all these companies have been around so long. Do you feel that it's a mission or just something you love to do?
You know what? I just think I grew up in the business from the time I was a little kid. I was 8, 9 years old. So at that time, everybody's parents wanted them to be doctors or lawyers. You wanted to please them, but after college, I wanted to come right here into the business.
Well, now, did you work when you were a boy in the business?
Oh, yeah, I'd go downstairs in the basement where my dad was making candy, and he'd have a little metal bunny molds. And I always wanted to go out and play and sled ride. And his remark was, here, when you make 6 bunnies, you can go. So, God, I had one mold. It took 25 minutes to make one. So by the time I got 6 done, it was dark. I wasn't allowed out.
Well, now, when did you actually come to work and have a job that you got paid? What was your first job?
Well, I came into the business in 75 after college. And at that time, I remember making $250 a week. That's what my dad was paying me.
He probably complained about that.
Oh my God, did he complain? And I just said, you know what, $250 is fine, but I'm going to do some things, and all I want is a percentage of what's going out that door that I make happen.
Well,
so that didn't work very well in the long run for him.
Well, he taught you well. And as a matter of fact, of course, I knew your father and mother, and I know your mother and your sister, and your dad was a really, really smart businessman, and he was dedicated to making this the best company he could possibly make.
He was one of the best salespeople I ever knew. He didn't go through the salesman's classes or anything else. He was just very charismatic, okay? People liked him. He liked people. He liked everybody. And it showed no matter who you were.
Well, he was doing something he loved, and he was selling a product that people liked, and he got a good reputation for service and for quality.
Hey, that was important to him, to make sure that what we were doing was absolutely the best product that we can put out.
Well, now, this candy business is highly competitive, and I know that you've got local competitors, regional competitors, national competitors. How have you managed to keep growing and in such a competitive environment? Do you think it's the quality and service that you've developed that's really kept you on top?
You know, I mean, that of course, hey, there's the two big key things that we make sure we try to do. You know, the best quality we can do and the best service we can offer. And basically from the time I started, it was about building the brand. I think you wanted to build a brand, build the name. And that's what people think of when they think about candy in Pittsburgh. We're hoping that they think about us. That was always our goal, to sit there and of course make people happy. But our success is in building our brand.
Well, now, are you the largest candy producer in the region?
You know, I really never thought about that. You know, maybe locally in the Pittsburgh area, I'm going to say probably, yeah. I mean, we have about 200 employees here at Sarris, and then we own Gardner's Candies in Tyrone, PA. That's up near State College, and there's about 200 employees there. You don't think about it when you think about 400 employees, and you think, am I crazy or what? But, yeah, you know, we sit there and, again, build the brand. You know, are we the biggest? Well, not in Pennsylvania. Pennsylvania's huge on candy.
Yeah, there's a lot of producers in Pennsylvania.
Well, you know, you have Hershey's. So for the candy industry,
you can start with Hershey.
As far as the lobby goes, they're the best lobby going for the candy industry.
Oh yeah, I can imagine.
So Pennsylvania's strong in candy.
Well, now tell me,
it's a mecca. It's the mecca of the candy industry.
Right. And I've been to the to the Hershey factory, and it is and toured the homes where all the orphans come and they live and they work, and it's a great company. But Sarris is just the thing I always think about if I'm thinking about local candy, and I know that you've got to be proud of what you've been able to create. And when do you sell? When do you sell most of your candy? What different times of the year? Certainly, it's got to be Easter's got to be one of the biggest times.
Yeah, Easter's probably the biggest. You know, you're called Easter, Christmas, Valentine's Day. You have Mother's Day. You know, those are the biggest things. But we also service, you know, about 1,300 locations, similar to like Giant Eagle, Shop and Saves, grocery stores around here,
and all the major pharmacies.
Yes, the pharmacies, and we do a lot with Hallmark all across the country, and we do Rite Aid. You know, there was a window of opportunity there when the drugstores, you know, always sold another brand of chocolates, and that brand went to the big box stores. You know, they went to Walmart, they went to Sam's Club, So that left a really nice opening for somebody, and we took that shot with them, and it's worked out very well.
Well, I know I had to make an emergency purchase of candy the other day for a couple of ladies that I work with, and I'd forgotten all about it, and it was Valentine's Day, so I stopped at a Rite Aid and got a couple of boxes of Sarris Candy, and they were really happy.
Great. It's convenient.
This Easter is going to be a challenge, I guess, with all the coronavirus restrictions. How has that affected your workforce, and how has it affected your sales?
Well, of course, we closed our store, so our storefront is closed.
Right.
What we've done is we made an impact on online orders on our website. So, and it's I don't think it's not funny, but it's interesting that, before you'd get 1,000 orders a day. And last Easter, plus you had your storefront. Well, now without the storefront, we're getting about 5,000 orders a day.
Good grief.
And we're doing a lot of mail orders. Only a handful of people decided to stay at home. But we have a lot of people here working, and we're shipping product out. This is a whole different ballgame now with this virus. People go home and they come to work. Nobody else comes in our buildings. Things like that. So we're still making chocolates now.
I know that I went to your store several times, and you also had ice cream there too, I remember.
Yes, we have ice cream, and we're just today opening up our ice cream parlor. Again, it's online orders, and it's curbside. So you place an order, you drive over, you beep your horn. I don't know how they operate it now. They'll text a message to these phones that we have, and they'll run the order out to the people in the car. So we'll see how that goes this weekend. But we're working hard at that.
So your Easter is going to be as big as it always is.
It seems. What we're doing with the opportunities out there. Again, having our products out in the marketplace, and people are all shopping for groceries anyway. So they're going to bypass. So if they want their Easter candy, they can get it there. And then you have a ton. I'm going to say a ton. You have a lot of people, ordering online. They don't want to leave their house. Pittsburgh is a very unique city in that the people that have left, and moved to other places, they're still here, and the transients, and they still order candy, and they still support businesses in Pittsburgh. They're Pittsburghers forever, and it just surprises me to see these people from California, Texas, Kansas, Oklahoma that we send orders to, and they leave little notes and say, "Hey, I'm a Pittsburgher. I'm ordering your candy." Stuff like that really surprises me, and it's amazing.
It's got to make you feel good. Got to make you feel good that when they remember Pittsburgh, they remember probably first of all the Steelers or the Pirates and Penguins, and then Sarris Candy. That's got to be a great feeling. It amazes me. But Pittsburgh people are unbelievable. Well, I know you can custom produce almost any size or shape or design. How is that possible? I always say, if people call me and say, I want to make something, and I always say, hey, if you can draw it, we can make it. Okay, and we've done a number of things that, just some crazy stuff that we have done that people have asked for. Simple things like, we did a peanut for Jimmy Carter at one time. Okay, and we did that, and that was interesting. But we also did. Well, he was a peanut farmer. Yeah, yes, that's right. He was a peanut farmer, and we also did an artist, a human body. She laid down, and we made a mold over top of her, and made 150 pounds. And we made it out of white chocolate, and we burned the chocolate so that it would look like marble. Wow. And we've made this white chocolate human person. It was 150 pounds. She did something with it at the museum in New York. But we had it in our store for a while, and then we shipped it out to her. And after that, who knows where it's at right now. Well, Bill, I want to thank you for joining us today. Before we leave, though, what is your favorite of all the things you produce? What's your favorite? Is it the pretzel, or is it chocolate-covered nuts, or what is it? You know what? If I grab something, I grab a peanut butter cup. A peanut butter
cup and a cup of coffee, and sometimes that's my lunch.
Ladies and gentlemen, we've been talking to Bill Sarris, the president of Sarris Candies, and they are an iconic company in Pittsburgh that everyone knows. And Bill, thank you so much for joining us, and happy Easter, and good luck with your business, and God bless all of you, your family, and all of your workers for helping make Easter a time that we can remember. This is Jim Roddey.
Thank you. We really appreciate it.
Thank you so much. Ladies and gentlemen, this is Jim Roddey for St. Barnabas, and this has been the best of Allegheny County, and certainly we know that Sarris Candy is one of the best. Ladies and gentlemen, be sure and listen to us next week on Saturday at WJAS at 9 a.m. and at noon on Sunday. And we'll be back with always the best of Allegheny County.